In 1904, a catastrophic fire destroyed most of downtown Baltimore in the United States. But when the fire crews from the other cities arrived on the scene, they found that their equipment was useless. And that's because their fire hoses all had different gauges. They may not have used the word interoperability, but in the inquiry that followed, the lack of standardized, mutually compatible equipment was found to be at the heart of the disaster. People were well aware of the problem. There were always other priorities. Sound familiar? Fast forward a century or so, I found that technology in the NHS suffered the same structural problems. Our patient record management systems were not and are not interoperable. When a sick person turns up in A&E in the middle of the night, there's no reliable way for the clinical team to get all the information that they need. In both primary and secondary care, our patient management systems are often full stack contracts. The hosting, the data, the applications, they're all built as one single system. And it means that if you want to change that system in any way, it's like swapping a crucial block from a Jenga tower. You risk the whole thing crashing. It also means that when better, faster tech is developed, the NHS can't always use it because we're locked into something that was cutting edge when I was at university. And sadly, that's a long time ago now. Last autumn, I set out my vision for technology in the NHS. I said I wanted our systems to be open and interoperable, continually upgradable, innovating, iterating, always improving. This isn't some unimaginable tech utopia, by the way. It's how the internet works. The problem is not technical, it is organizational. It's to do with legacy, with a lack of skills and confidence, with a culture of risk aversion, with a belief that technology is the IT department's issue rather than something fundamental to the way that any modern organization works. The biggest recent development is the creation of Nhs X, our new tech transformation unit. So Nhs X has brought together our scattered tech leadership from all parts of the system into one decision-making point, giving them the powers and the policy tools and the clout to get things done. The second goal of X is to bring the mindset and the practices of the internet to the way that we deliver the NHS. This means nationally agreed standards, locally led delivery. Commission what you want. Commission what you want. But it has to meet our standards on cybersecurity, on data access, and on interoperability. I believe it should be as easy for a GP surgery to switch provider as it is for a small business to switch bank accounts. Under the new contract, providers will have to follow our standards on interoperability and data access. Systems will be continuously upgradable. Patient data will need to be securely hosted in the cloud. Your medical records should be accessible from wherever you are in the NHS, just as you can get your emails on any device. And we can only build the NHS of the future on safe, secure systems that we can rely on and that we can trust. We're in the middle of investing £150 million to put in place new protections. And I can tell you that over 100 NHS boards have now received training from GCHQ-accredited experts on cybersecurity threats and the actions they need to take to protect their organizations. And from today, we've launched a new data security and protection toolkit that everyone in the NHS who deals with patient data must use. A single set of standards to help health and social care providers improve cybersecurity and carry out self-assessments to measure how well they're doing and how much they still need to do. Digital technology is going to fundamentally alter our relationships within the NHS. Remote access will change clinicians' relationships with patients for the better. Technology will not be at the expense of humanity. By contrast, it'll be exactly the other way round. Technology will put more of a premium on the human ability to explain, to empathize, to reassure, to contextualize. It'll mean more time with patients, not less. For patients, digital transformation will mean less time hanging around in waiting rooms, more care at home. Ultimately, technology that makes lives better. Technology that lets the NHS do what it does best, which is to care for people. So let's make it happen.